Hello and welcome to this channel. My name is Victoria and in this video we will talk about chronic abdominal pain in children. This is the second part on abdominal pain in pediatric patients. If you haven't seen the video about acute abdominal pain yet, you can do that also in our playlist if you like. Chronic abdominal pain is defined as abdominal pain lasting for over 3 months. It can be permanent or recurrent and is common in children and adolescents. Chronic abdominal pain can be organic or non-organic. Non-organic pain refers to any pain without the evidence of anatomic, inflammatory, metabolic, or neoplastic abnormalities. Recurrent abdominal pain, which is part of chronic abdominal pain, is defined by 4 criteria. The first one, the patient must have had at least 3 episodes of pain. The second, the pain is so severe that it makes the child unable to do certain activities. The third one, the pain episodes occur for over a period of 3 months. And the fourth and last one, there is no identified organic cause. In case of a patient with chronic abdominal pain, an evaluation of the patient should be done by taking the medical history, making a physical examination, and a stool testing for occult blood to find possible organic causes. It is also important to note the location of the pain, as for example esophagitis and a gastric ulcer cause pain in the epigastrium. Also, the radiation of the pain should not be forgotten, as for example back pain can indicate problems with the pancreas. It is also important to ask about the onset, frequency, duration, intensity, and character of the pain. A patient might, for example, say that he or she always gets abdominal pain in the mornings before going to school, but in the evenings and on the weekend the pain is gone. This might indicate that a non-organic or psychiatric disease is the culprit of this pain. Also, a rather cramping pain is usually indicative of a gastroenteritis or intestinal obstruction, while a more burning sensation is typical for example, gastroesophageal reflux disease. Red flags in the diagnosis of abdominal pain are fever, anorexia or weight loss, blood in the stool, jaundice, edema, organomegaly, back pain, skin changes, and urinary symptoms. If any of these occur, the patient should be evaluated carefully and thoroughly to not miss any severe diagnosis. It is also important to ask the patient how severe the pain is for them. It is possible to ask them to grade their pain in a scale of 1 to 10. Pain perception is individual for everyone and is usually based on previous experiences and perception of the pain. The patient should also be asked if the pain interrupts their sleep, schoolwork, or usual activities. Another factor that is important to consider in the patient history is whether there are factors that alleviate or provoke the pain occurrence. For example, in the case of mesenteric ischemia, the pain usually starts within 1 hour of eating, while in the case of a gastric ulcer, the pain is reduced after eating. In the next part, I would like to talk about a few diagnostic tests. Laboratory studies may, for example, be of less importance if the history and physical examination reveal enough information for a diagnosis. However, in some cases, further laboratory testing is necessary. A complete blood count, sedimentation rate, C-reactive protein, and cultures of stool and urine, for example, can be very important factors for a diagnosis. Elevated stool calprotectin levels usually indicate an inflammatory process in the intestines. An ultrasound examination of the abdomen can be recommended in cases where kidney, gallbladder, or pancreatic pathologies are suspected. An upper GI X-ray series is usually the examination of choice for diseases that affect the stomach or small intestines. Another important differential diagnosis is the intolerance of different sugars and food components. So, for example, the breath hydrogen testing is done to rule out lactose or sucrose malabsorption. Lactose intolerance is so common that it must be kept in mind that a patient may have chronic pain and be lactose intolerant, but there might be further pathologies. So a clinician should not rest about this patient too quickly. So to sum it up, the differential diagnosis in a child with chronic abdominal pain are broad, but they can be generally divided into two main groups. The first group is the organic disorders, so diseases that are either biochemical, structural, or physiological in nature. The second group is the functional disorder. For those, there's not a specific test or test result that puts the diagnosis. An example for those is diarrhea caused by anxiety and stress. In the last part, I want to mention some possible causes for chronic abdominal pain according to the areas of the abdomen that are affected. Let's start with generalized, poorly localized pain. This can be caused by lead poisoning, necrotic bowel disease, mesenteric ischemia, hypercalcemia, and porphyria. Epigastric pain, so pain in the area of the stomach, can be due to cardiopulmonary diseases, gastroesophageal reflux disease, chronic pancreatitis, splenic infarction or splenic vein infarction, lymphoma, or gastric or esophageal malignancies. Pain in the right upper quadrant can be due to disorders of the gallbladder or the liver, as chronic cholecystitis, chronic portal vein thrombosis, or hepatocellular carcinoma. Pain in the lower abdomen can be due to pregnancy or other gynecological disorders, diverticulitis, irritable bowel syndrome, urinary retention, or other urinary tract disorders. Diffuse pain, so pain that is difficult to localize and that affects most of the parts of the abdomen, can be due to constipation, celiac disease, Crohn's disease, lactose intolerance, or a gastrointestinal malignancy. Of course, besides disorders of the organs of the abdomen, also other things, as rib fractures, muscular disorders, or trauma, have to be included in a differential diagnosis. That's it for this video. Thank you for watching, and if you like our channel, please subscribe. Thank you very much.